Hello, my name is Daisy, and today I'm going to be doing the checkup for the dry and moist dressing. So the first thing you want to do, of course, is you want to look at your treatment record to make sure that the physician has ordered a dressing change. I've already checked the TAR, I've checked the patient's name, date of birth, and made sure that there was an order for the patient's dressing change. I've checked for the location of the change, and it's going to be on her abdomen. She does have an abdominal incision. So the first thing that we want to do is we want to come into the patient's room. We want to perform hand hygiene, provide the patient with some privacy, and identify the patient with 2 identifiers, which I've already done that over here. We have Miss Jane Doe today, and Miss Jane, could you tell me your first and last name? Okay, so her first name is Jane, her last name is Doe. Her birthday is 12/13/1950, and I already went ahead and I verified that on the patient's TAR. So I'm gonna go ahead and explain to the patient what we're doing today. So Miss Jane, today we're gonna be doing a dressing change on your stomach. So we're gonna be cleaning it with normal saline and patting it dry. The doctor's orders is to clean the abdominal incision with normal saline, pat dry, and apply a dressing. So we're gonna go ahead and do that. But first I'm gonna perform some hand hygiene and apply some gloves. So I've applied some gloves. I've made the patient comfortable and provided privacy. And like I said, I've already doubled and triple checked the patient's order. So right now we're just gonna apply clean gloves to remove the patient's dressing. Okay, so I'm just gonna uncover the patient on the side that needs to be changed, so which will be on her abdomen. I'm gonna go ahead and drape the sheets down and provide as much privacy as I can for the patient to make them comfortable. I'm gonna go ahead and remove the dressing. Okay, Miss Jane. Okay, so I'm gonna just go ahead and throw this in the trash. And before I did that, I did forget to mention it at the beginning, but I did pre-medicate my patient with pain medication about 45 minutes ago. The patient had a pain level of about a 6, and it's gone down right now to a 2. So the patient is tolerating the pain well. I went ahead and assessed the patient's wound. There's no signs and symptoms of infection. So there's no redness, no drainage, no warmth, and no any other signs and symptoms of infection. Okay, so since we have already inspected the patient's wound and made sure that there were no signs and symptoms of infection, I'm gonna go ahead and remove my clean gloves and throw them away, and then perform some hand hygiene as well. Okay, so then at this point is when I would apply the appropriate PPE. If I did have the appropriate PPE and needed all of it for this situation, I would apply my gown first, and then my mask, my goggles or face shield, and then at last my gloves. So I'm gonna go ahead and apply my sterile gloves. So I've already performed some hand hygiene. And then I also have the necessary tools for the wound care over here. I have these gauzes filled with normal saline, or moistened with normal saline, and then my dry ones to pat dry with. And then I also have my dressing as well. So I'm gonna go ahead and put on my sterile gloves. Okay, so I've already applied my sterile gloves. And then while I'm performing this, one hand is going to be my sterile hand, and my other one can be considered my clean hand. So I'll consider my left hand my clean hand. So since we've already examined the patient and there's no signs and symptoms of infection, I'm going to go ahead and first clean the patient's wound with the gauze moistened with normal saline. So I'm going to go ahead and pat dry. Miss Jane, is there any discomfort or any pain? No? Okay. Okay. And make sure that anytime I clean the patient's wound with the normal saline, that I only pass through the wound one time with each gauze. And then I've also explained to the patient to go ahead and let me know if there's any discomfort or any pain during the dressing change. Okay, so now we're just gonna go ahead and pat the patient's wound. And then now I'm just gonna go ahead and apply the patient's dressing. Okay. So like I said, the patient's wounds look okay. There was no signs and symptoms of infection, no drainage or anything like that. Okay, so we're gonna go ahead and apply your dressing. Make sure that I don't apply the patient's dressing too tight. Okay, Miss Jane, we're all done, okay? Is there anything, are you in any pain or experiencing any discomfort? No? Okay. So you just let me know if you need anything, okay? So then at this point, I will take off my sterile gloves. And also provide the patient with some safety. Well, do some hand hygiene after the gloves have been off. Make sure that the patient's bed is in lowest position, the collar within reach. And then I've also let the patient know to let me know if there's any discomfort or any signs of pain. So after I've left the patient's room, I'm gonna go ahead and document in the treatment record of what was done to the patient, if there was any signs and symptoms of infection like redness, drainage, warmth, or any pain or discharge during the patient's dressing change. So I'm gonna go ahead and document that after I'm done. And then I would also, in the documentation for the patient, I would also document that the patient tolerated the dressing change well. And then I would, of course, after I finished my wound care and covered the patient up, I would remove my PPE. So I would first start off by removing my gloves. Then I would move on to my gown, which I would be removing it away from me to prevent any contamination. And then I would remove my mask and my face shield if I did use them, and then perform some hand hygiene. And of course, documentation like I mentioned before. So the difference between what I did in the checkoff, which was a dry dressing, a wet dressing, it would consist of the same thing, checking the patient's, the doctor's order, make sure that I have the right patient and then the right dressing change. I would apply necessary PPE so that if I needed sterile gloves, then I would use those as well during the wet dressing change. The difference would be that if the patient's wound had any tunneling, then of course I would assess the wound and clean it, but the only difference between the dry and the wet for this would be to moisten the gauze with the appropriate or with the prescribed solution. And then after the gauze is moistened, I would drain out the excess liquid from the gauze and then unfold the gauze and gently pack the patient's wound with that gauze. After the patient's wound is packed, I would go ahead and apply a dry dressing on top and then cover it with the dressing that the doctor has prescribed. And of course, document what was done during the procedure and if the patient tolerated well, no signs and symptoms of infection were noted. Okay, so also with the wound dressing change, you want to make sure that you put in your initials and the date that the wound dressing was changed.